Optimize heel raises for matters. The single leg heel raise is commonly used by PTs, and it is so common in treatment that a lot of diagnoses and issues are actually based on doing a single leg heel raise. That's the backbone of their rehabilitation. So it's really important for clinicians to know an evidence-based way to perform heel raises. This is really, really important. Variations in speed, ankle dorsiflexion, plantar flexion, and form skews clinical results. So fortunately, new research has found that single leg heel raises can really improve performance, and we can improve our accuracy of testing. And the way to do that is to have a standardized approach. Quick summary of clinical pearls. Single leg heel raises should be performed at 60 beats per minute or 30 reps per minute. The knee must remain straight. Full plantar flexion, range of motion must be achieved without compensation at the hip or the ankle. Now, also, slow resistance training should be used prior to plyometrics, and we should really be progressively loading these calf raises, these heel raises. I'll show you how to do that in just a little bit. But first, let's standardize our single leg heel raises, okay? So first off, we want to think about our good guidelines for testing and for exercise. I'm going to make that a clear note here, that the testing is going to reflect what we should be doing in terms of exercise prescription. 60 beats per minute, 30 reps per minute, full plantar flexion range of motion must be achieved with each rep. Knee must remain straight, and then we want to cue no compensations of the trunk, the hip, the ankle, the foot. They should be doing these barefoot if possible, but if it's footwear that they're using because they need to, just make sure it's consistent. Then also we want to be consistent with the surface type. We want a flat surface versus step. That very much matters. And some of the clinical pearls here are going to be standardized heel raises with proper form are going to be 12 less reps on average. That's a staggering number. That's going to influence what we can actually see clinically, what the information we're getting, our return to run programs, our LSIs, all those things matter. Slow heel raises are going to prevent that stretch shortening cycle, and then slow resistance training must be used prior to plyometrics. That's really important. So why is it so important to be able to get this accurate single leg heel raise test done? Well, it's really because it makes a difference with our outcomes. It makes a difference when we're looking at calf muscle capacity, because that's going to our decision making for things like return to run programs. It's going to be our decision making for exercise prescription. And as I mentioned before, 12 less heel raises were seen with those folks that used a standardized single leg heel raise testing procedure. So what do we want to do here? Well, we want to avoid the re-injuries. We want to avoid incorrect exercise prescription. We want to avoid all these bad things that can come from a lack of data or incorrect data. So what happens when we standardize them? Well, we get much better results. So one of the reasons that folks are doing more heel raises with non-standardized heel raising test procedures is because of the stretch shortening cycle. Similar to plyometrics, with faster heel raises, you get a quicker elongation of those muscles and tendons, and that's going to prime the muscle, it's going to prime the tendon for more forceful and quicker concentric contraction. So while 25 heel raises has been an average seen in the literature, unfortunately this wasn't using the single leg heel raise testing protocol. Now, we also want to be mindful here because heel raises not only are good to test the right way, but we want to think about the exercise as well. Now, the testing speed is slower, so it only makes sense that we want to make sure this exercise speed is slower too. Now, some research has been out there about using an even slower cadence, 3 seconds up, 2 second holds at the top, 3 seconds back down. However, this is the latest research that's out there that's showing that this testing is really the accurate speed we should be using, and more research is confirming that 60 beats per minute is a really good standardized approach to use. So we want to prescribe single leg heel raises prior to plyometrics during progressive loading. And again, progressive loading is really this gold standard that we're finding in terms of recovery and rehabilitation. And especially with calf strengthening, we want to approach it with slow resistance training, followed by heavy slow resistance training, and then plyometrics. Let's take a look at this graphic here so we can understand a little bit better. So in early rehabilitation, we'd want to do things like an isometric heel raise. And then slow resistance training, meaning that 60 beats per minute, 30 reps per minute, which isn't that slow, but it is slower than many people will do. And we want to start with a low volume of sets and reps. We want to progress that to double leg, from double leg to single leg. And then our goal here is to get approximately 3 sets of 15 rep max without pain. Then we move on to our middle rehab, our step 2 here, which is going to be progressing to heavier slow resistance training. So still using the same cadence, the same beats per minute, but we're going to progress from 3 times 15 rep max to 3 times 6. And the reason why is because we're going to have more weight and adding more intensity. That heavy part of it is going to be really important, and that's going to build muscle strength. Now, we can at this point consider transitioning into plyometrics, but there's a couple key things to think about. First off, one of the ways we can consider to transition to plyometrics can be faster heel raises. That's a good way to be able to start getting that stretch shortening cycle to engage. However, we also want to obviously complete step 2 pain-free, but we want to think about adequate hip and knee stabilizer strength as well. We need those to be intact so that the whole system, the whole plyometric system, inter-muscle coordination is being used correctly. So the ankle is not compensating for hip or knee musculature as well. And then lastly, slow jogging can be a really good way to start. And there's a couple different ways you can start plyometrics, but one thing we want to think about as we start plyometrics is we want to think about the impact loading. We want to be able to put on the brakes before we have to put on the gas. And if we can't put on the brakes, then we shouldn't even think about putting on the gas. So think about it this way, and slow jogging can be a way to go. This isn't a conversation about plyometrics, but a good rule to follow is going to be some running in place can be a nice place to start plyometrics, and we want to think about making sure they can impact load appropriately. So again, we want to build that calf musculature, that strength in the foot and ankle complex before integrating multiple joints during plyometrics. And then we also want to think about a standardized single leg heel raise that's going to most effectively strengthen the calf musculature. Lastly, it does take a little more time for patients to think about the 60 beats per minute. That takes a little more engagement, but that's where we come in as clinicians, and we want to educate our patients on the importance of this. This is going to make a difference for their outcomes. We want to make sure they're on board for it, and we want to make sure they know that's going to help them get the most effective results.